Hi, this is Jamie Inman with Stay in the Pink. My blog is on that website, stayinthepink.com. And I am on the breast cancer in the group on WEGO Health. And Alicia Staley and Casey Quinlan and I are doing this little TV show, conversations about the issue of the label of cancer victim, breast cancer victim. A story was shared on WEGO Health a few weeks ago dealing with the serious topic of a new development in breast reconstruction where I think fat tissue is actually harvested from a woman's body and grown and to create a new breast, which is a wonderful thing. But the magazine that had the article on the cover did a Playboy type of presentation with cleavage, and so the article was talking about promulgating that kind of philosophy of women being about sex objects and the offensiveness of that to women in particular, and especially breast cancer patients. So anyway, Alicia responded to that story rather strongly. Particularly two words stood out to you, Alicia, and they were the words mutilated, as in mastectomy, and victim. So I was sort of surprised that your first posting here on the video, Alicia, was so calm, because the word you used in the blog was that you were speechless, and I got the feeling that you were incensed by those two phrases in the article. So I wanted to respond. I hope I hear back from you with what made you so upset and how you feel about it and why. But I will tell you how I feel about those two terms, the mutilated and victim, in relation to breast cancer. First, I'll just say it off the top that I'm not especially offended by either one. I'm 63 and a half. I grew up when cancer was a whispered illness. It was something that people were ashamed of. People didn't talk about it in polite circles. It used to be in the same category as what used to be called venereal diseases and sex and that sort of thing. Well, everything is out in the open now, but it wasn't then. And I think that the tide turned when Betty Ford, First Lady Betty Ford, revealed that she had breast cancer, and it was called coming out, much in the way that gay people come out of the closet nowadays. That really does tell the story about how cancer was perceived at the time. So I have a feeling that to counteract that shame that people felt, the word victim came about because people said, after all, they don't have anything to be ashamed of. This has befallen them. People can't control if they get cancer. Of course, we know a lot more about it now in terms of lifestyle choices and such, but for the most part, we have no say in it, and we are sort of a victim of this terrible disease. I think the pendulum continued to swing over, and then we started calling people survivors, to put even a positive, conquering sort of spin on it. And that's all well and good. Anything that helps
people be open about their cancer is a good thing. If it helps them to pursue screening and treatment, that's a wonderful thing. Certainly, we are all more than survivors on the day that we find out we have cancer. And in too many cases, that surviving doesn't last very long. And I think that's what you were saying, Alicia, that it can seem like a slap in the face to the people who only have weeks or months to live. They do survive for a while, but that whole tone is maybe insensitive. But I think it came from a more sensitive and caring place when it first was developed. And I think the same thing can be said about the concept of mutilation, that in the early years, the only treatment for breast cancer was radical mastectomy, where they removed the muscle down to the bone, and women were left looking like a piece of them had been hacked off. So
that is a holdover perhaps, although I must say that I do a lot of searching on before and after pictures on breast reconstruction because I did have it and I want to know what's going on in that field. And I'm very shocked at the condition of some women in the before pictures, that it isn't just a simple straight line surgical scar, that some of them look mutilated, quite honestly. So I think people might be offended because it is a shocking thing to say and adds to the sort of sense of horror that one feels at the diagnosis of cancer, and we don't want to scare people away from finding out if they do have it. So anyway, those are some thoughts on it. I look forward to hearing your responses. Wonderful. I can't wait to hear from you. Bye-bye.